Welcome all of you. We are here today to discuss about some salient features and points regarding MRCPCH. Thank you so much. Today we are here to discuss. I welcome all of you. I am here. I'm your mentor for MRCPCH course, and I will teach you regarding the foundation of practice. Today we have a session that in this session we will give you a guideline regarding course and regarding MRCPCH. So let's start. This is our course that in this course we will um, we will discuss about the foundation of practice and theory and science. And this course will start in the first second of November. And we will give you we will give you orientation about the features of MRCPCH, what is exactly. And in this session, we will guide you about how to get your eligibility, how you could register yourself, and how you can proceed towards this prestigious degree. I'm your mentor regarding foundation of practice, and Dr. Ashna will teach you theory and science. In today's session, we will discuss about what is exactly the exam. This is what is the eligibility criteria and what is the exam pathway and how you will register yourself, and the main point that how you will book the exam, because nowadays students are facing so much problem and hurdle while booking the exam. And I will give you the overview of the exam structure and criteria, and we will guide you regarding how you will go ahead and what are the pathway and how you will opt this course and how this course will help you to pass this prestigious degree. And in the last but not least, we will have the question and answer session. So, what is exactly MRCPCH? So, MRCPCH is the professional qualification for pediatrics from the Royal College of Pediatrics and the Child Health, and it can consist of three theory part. The part one consists of foundation of practice. It covers the basic knowledge, and you will know the brief knowledge about the pediatrics and theory and science. In theory of science, they expect that you should have the practice. Have the knowledge of around ST3 or ST4. The passing criteria of foundation of practice is somehow 60, 60 is more than 65, sometimes 62. It's according to the centile. While as theory and science, the passing criteria is not that much high, but relatively theory and science are a bit difficult than the foundation of practice. Now, the eligibility criteria for MRCPCH FOP and like we in a short we says FOP, that the foundation of practice, and TAS, that is theory and science. So even you are the just pass your um, MBBS exam or just have your degree. After that, you can apply for it, and or um, if you have some clinical experience, is you have, then it will help you, especially for the TAS and FOP. But if not, then it's okay also. The MRCPCH also consists of two theory exam. The part one comprises of foundation of practice and theory and science. It's you, and the second part is applied knowledge of practice. Okay, the pathway for MRCPCH is you have to pass the FOP and TAS in the first step to completing the MRCPCH. Then the second part is part two. You can opt that either you can choose the part two also or part one. Vice versa, you can give theory exam. Even you can apply the applied knowledge of practice first also. And but I will recommend that if you are beginner, then that it's very good that you can go ahead with the foundation of practice and theory and science. And after that, you have to give the clinical exam. Um, Now the question arises in students' mind then how to register the MRCPCH exam. This is a first step is to register yourself. There is a form in MRCPCH website. You have to log into that website. You have to make the account, okay, on their official website, and they will ask you documents for. They will ask for verification, and they will verify. Actually, they want the basic degree that has to be verified from your college. Then, it will take maybe 2 or 3 weeks to get verified by your college. Then after that, when you will have your registration, then you can go ahead the foundation of practice and theory and science. Okay, I will suggest that they conduct the part one on the same day, like they usually conduct the foundation of practice in morning and theory and science in the evening. Uh, it's your choice that you can give the foundation of practice and theory and science in one day, or either uh, uh, you can select that in one diet you can give the foundation of practice, and the second diet you can give theory and science. And then after registration, you just go ahead, pay fee, and receive confirmation. I will tell you that you should remember and the fees. Yes, somebody asked something, I think. FOP is foundation of practice. Okay, foundation of practice. We call the short form is FOP. It's a part one. As I told you, the part one consists of two parts, foundation of practice and theory and science. If you will pay the foundation of practice and theory and science in one go, like morning and evening exam, then it will save your money. And they conduct this part one like in three diet, like in 1 year, they conduct the three exams. Nowadays, students are very much curious to know that how I book the exam. Welcome. Nowadays, it's very difficult to get the seat. First of all, register yourself, and I will advise you when you are planning to give this exam, part one, part two, or either clinical, part one especially. Then you have to go ahead the registration at least 2 to 3 months before the when you are planning for exam, because before 12 weeks they ask for the payment. So before applying, you should be registered on their website, then easily, because if you will not register you cannot have the seat, and you have to log in according to their UK time, where you are living, in which zone of the world you are living. You have to register according to the UK time. The opening window, they are very particular about the time, and if they said that suppose the upcoming window will open around 9:30 UK time, then if suppose if you are sitting in Pakistan, so you should open and log into your window at least 2 o'clock, and you have to open your laptops at around 2:10 of Pakistani time, because UK time is 5 hours ahead than Pakistan time. Pakistan time, sorry, 5 hours ahead than the UK time. So make your clock according to them. Uh, Examination criteria nowadays, they have changed the examination criteria, because before that they usually in the exam they ask the extended matching question, and nowadays they remove the extended matching question. Foundation of practice is very basic level of exam, and even you have done house job or internship in pediatrics, you can easily pass the foundation of practice. It's a multiple choice question, and you have to solve the 100 question in 120 minutes. Um, and it's only the multiple choice question. Maybe it's scenario based, maybe sometimes it's very straightforward question. Theory and science is also, now they remove the extended matching question, and you have to solve the multiple choice question, and it's a bit tricky rather than the foundation of practice. Both exams require a passing score calculated both on difficulty and number of questions. Like, I will tell you that if suppose there is 100 question, there are 100 question, and each question they score different marks. If there is a tricky question, then you solve this MCQ correctly, then you will get more mark. And if you it's very straightforward question, then you will get a an average mark. Dr. Raza, you have asked the question. The question will be from PEDS or general? No. The foundation of it's a Royal College this pediatric exam. So all of the questions uh, is from the pediatrics. Either it is in foundation of practice, either from the theory and science, either from the AKP. They will ask a question related to PEDS and the child health, and they consider the PEDS category from newborn up till age of 18. So maybe you will come across a question like related to newborn and question to puberty and question related to adolescence also. I'm very happy the questions are coming. So nowadays, this you can see the booking dates on the screen, like exam dates. Suppose in Diet 1, they conduct this theory exam in thrice in a year. Fee structure, they vary it. You can check on the website, but we will, you can just post on our WhatsApp group, and our coordinator will, answer the fee structure because it varies. So, but if you will give the foundation of practice and theory and science together, then you will get some off. But in and what I was saying, yeah, they conduct this theory exam thrice in a year. Like the coming date will be on February. In Wednesday, 19 February 2025, and the application window will open on Monday, 6th December 2024 at 9:30 a.m. So the window will open if you are sitting in Pakistan. So it's 2:30 a.m. No, there is no OET required and there is no English test required for this theory exam. And if you pass this exam with the clinical one full exam, then you will get the GMC registration. And for the GMC registration, of course, you need you required to pass your OET exam. But for the theory and science and foundation of practice, you no need to pass this. Like PLAB, you first have to pass the OET exam. Yes, no need to pass this OET exam. You can, if you just have your MBBS degree, so you can apply for this theory exams. So application close on Friday, 6th of December 2024, but don't wait for this application closing time, and because the seats will, will vanish within a minutes. No problem. Thank you. Welcome. So they have, options. They have given you the options like you can opt the online or you can go ahead with the test centers. But nowadays students are getting very difficulty while getting the online seats because those countries who have the test centers, they usually offer them to go to their centers and sit in the test center. But if you don't have opportunity to go to test center, you can apply for the online. And online invigilation is worldwide. Only few countries they don't give the online chance. Like you can sit in your home and you can give the exam. Like in UAE, you're not supposed to go ahead with the online exam. Like you can sit in your home and you can give the exam. The online criteria is quite difficult, and for that you have the proctor exam. There's a proctor software, and you have to put two devices that you have to keep with yourself. But students are getting very difficulty while getting this online seat. There's no criteria about to get the online seat. I will just tell you in a couple of minutes. Um, Dr. Afreen, if you in your city, especially if you have the center, then I will recommend that go ahead with the center, because if there is some internet issue or there is some electricity issue, then they will be responsible. You will not be responsible for this. If you're sitting in your home and giving the online exam, and you're fortunate one that you get the chance to, you have the seat, you will get the seat. But um, So, you have to face and very difficult if there is some internet connectivity issue. Okay, yes, no center in Karachi. Yes, I know that. No, unfortunately. Yeah. Regarding online exam, I will tell you that you have to give them some evidence that you are far away from 200 kilometers from the center, and you have some adjustment problem, and you have to provide some evidence that utility bills they've asked, and they ask some contract for the home also, like utility bills and all. This written on the website. Tenancy contract they ask, and utility bills. And they said that please don't give us the telephone bills. Mobile phone. Yes, mobile phone bills. So I will recommend that if you can go to the center, please go ahead with the center, because it will be, you can get the seat in the center first for all, and the second, the in the home, if you are sitting, then you have to responsible for all your electricity and the internet, and you have to put one device in front of you, and if you cannot go to washroom in between the exam, so there are a lot of things that you have to handle by yourself. Hope so that I answer all the questions. So, we have a exam course that Med Exam Expert have a regular course, and its course duration for Foundation of Practice and Theory and Science is 3.5 months, and it will start from the 1st November 2024. Why choose our course? Because it's very comprehensive for MRCPCH FAB exam 2025, and we have a faculty that will have extensive experience in pediatric medicine and MRCPCH success. So let's talk about our course. That in our course you can have the topic wise interactive live sessions that with your mentors. We have a 16 sessions, like 8 for the foundation of practice and 8 for theory and science. And you can avail the chance that you can have the live recording sessions. And if you unfortunately if you're not able to attend the class live session, you have the option of recorded sessions, and you can have the previous recorded recall sessions also in the past exams, and you can opt the PDF of the live sessions also. And after that, even you plan for the exam, you will have a mock exam. Somebody asked something. How many times you can appear MRCPCH? How many attempts are there in a year? Yes, very good question, Dr. Raza. Actually, for each theory exam, you can have 6 attempts. And there are 3 attempts in a year for each theory, and uh, I mean to say that thrice in a year, they have attempts. For clinical, what is the next FOP task if we cannot attempt FEM? What is next foundation of practice if we cannot attempt FAB? Okay, you can go ahead with the next attempt, like they conduct the 3 exams. You can have the June one also. If you don't want to give exam in February, it's okay. If you're not prepared, it's okay. You can go at the next date also. I hope I answers all questions. So we were discussing about, welcome. We will discuss about the PDF of the solve recalls, mock exam, and just attempt this a mock exam just if you are planning for exam, because if you will give the mock exam and you will score low, then your morale level will become low. So, and we have a book, access of the book, that what recommended books are required for this exam. Any other questions? No, 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 no. No, we cannot give 3 theory exam in one setting. Uh, Actually, the part one they conduct on one day, like I told you that for foundation of practice and theory and science, one in the morning, and foundation of practice in morning and theory and science in the evening. And the second, the applied knowledge of practice is 1 month before. the part one. So yes, if you are well prepared, but I will not recommend you because these are very expensive exam. If you think that you are very confident, so in February they conduct the applied knowledge of practice, and this the part one theory and science and foundation of practice. Yes, you can give in one day. After how long the result comes roughly for foundation of practice in theory and science? Okay. They usually give the exam after 1 month, and sometimes they have written on their website that it comes after 6 weeks. Okay, I already told you that there are 100 questions and theory and science and foundation of practice, and uh, and you have to solve this 100 question in 120 minutes. We have a question answer questions, guys, also, doctors. Um, hmm, okay. Uh-huh. So why you choose a med exam expert? Because this is a proper website and it's a topic-wise live sessions for targeted learning, and uh, we offer you that you can ask questions. We have a study group that we are launching our moderator that they will help you, and question and answer experience with MRCPCH mentors. Personalized feedback and continuous support is always there. If you have any problem, we have a WhatsApp group and support group and very strong support group, and our moderators are working on it. So you can ask and you will get the answers very quickly. Access to community for peers preparing for the same goals. So, so just have an overview over this theory and science and the task session. The total duration is 1.5 months, and total sessions will be 8. Dr. Ashna will conduct this session. Session 1 start from tomorrow, 2nd November. It comprises of CVS respiratory ENT. Session 2, it comprises of endoderma genetics adolescents. Session 3 on 16 November, neuro MSK, ophthalmology and behavioral sciences. Session 4, nutritional neonatology, gastroenterology and hepatology. Session 5, 30th November, nephrology, hematology. Session 7, ethics, pharmacology, immunology. Session 7, palliative statistics. And session 8, the last one, doubts and discussion. That's awesome. Yes, we already told you the session lasts for it can last about 2 to 2.5 hours. And the mentor will discuss all the topics and answer your questions and answers your query. Doctors, can you please ask this question in the end? So now, the foundation of practice total duration will be 1.5 months, and the total session, and I will conduct this session. This foundation of practice, it's a bit easier than the theory and science. In the first session, we will conduct the diabetes, endocrinology, self-harm, oncology, heme, clinical cases. Clinical cases are very important, and along with the guidelines. Second session and the 10th session of the whole course will be the GIT, hepatology, surgical abdominal condition, immunology, allergy, and clinical cases and guideline. 11th session or third session will be clinical cases, guideline, growth, nutrition, cardiology, and infection. Fourth will be a clinical case along with the guideline. In each session, we will discuss the relative guideline along with the topic like palliative care, management, respiratory, and ENT. The fifth one we will discuss the guideline along with the safeguarding, patient safety, and ophthalmology. The sixth will discuss about the musculoskeletal neonatology and neurology. 15th session will be the neuro and the neurodisability, psychology and metabology, metabolism. And in the last one, we will discuss along with guideline, genetic dysmorphology, adolescence and medical and dermatology. So, anyone have any question? Open your mic and ask the question. So meanwhile, I will read the session, read the questions and answer all this. Anybody have any question? Please open your mic and ask. Somebody asked that how long each session lasts. Dr. Maria asked this question. And before that, okay, let me check. Yes. Mm.
Hello.
Yes, hello. Hello. Hello.
Hello.
Yes, hello. Somebody asked Dr. Afreen. Okay, I cannot hear you, doctor. Can you please open your mic? Okay, Dr. Afreen Humayun asked that I cannot attend classes now. I will attempt for June. When will classes started for June? Okay, you can take the session right now and just continue with, or you just talk to a coordinator, because this material will remain with you. You just ask these things to our coordinator. Top in 120 minute, tab, what is this? Task in 120 minute and task in 120 minutes for both. Yes, you have to solve 100 questions in 120 minutes for both foundation of practice and theory and science, doctor. For Tar, I cannot, if I misspell your name, so sorry for that. Somebody asked that after FOP and TAS, how many months required for AKP exam preparation? It's up to you. If you're quite confident, you can give after the next time the AKP exam. It's up to you. Even somebody asked that can we give the three exam in one go? Yes, if you're pretty much confident, then you can give, because part one they conduct just after the AKP, one month just after the AKP. But I will recommend, these are very expensive exam, so be prepared. And I think just after 3 months you can go ahead. How much each session last? Like how many hours a day? Probably it will be around 2 to 2.5, even sometime 3 hours also. It's depend upon that we cover the topic, how much we cover the topic, how much time it takes to cover the topic. Okay, coordinators kindly. Okay, 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 okay. Can we give exam here? Yes, yes, Dr. MSA, you can give the exam in Pakistan also. Even I want to tell you that this is very, good news for Pakistanis, that they are now conducting the clinical exam. Before that, the students were facing so much hurdles for the theory exam. They used to go abroad to give the theory exam, and people used to go UAE, sometimes Singapore, to give the theory exam. Now exam has been open for last 3 to 4 years, even before COVID. Yeah, in the COVID era, they opened the exam centers in Pakistan also, or even online. If you are fortunate one, then you will get the seat. Then you can sit in the online exam also. But those countries who are hosting, they prefer to give the exam to their centers. If we follow only what being taught in our session, yes, why not? Yes, yes. For foundation of practice, Kinza Shafiq, for foundation of practice, you have just the basics of or fundamentals of the pediatrics. Then you will easily pass the exam. What will the charges of your session? So you just ask our team. We have a team. We have a coordinator, and they will tell you accordingly. Maria has asked about the charges now. Okay. Recommended books, yes, there are we have a in our website there are so many books are there, but few books that I will recommend that you should go ahead, like foundation of practice. You should have a sound knowledge of survival guide, pediatric survival guide, and few topics I will recommend you to read from the illustrated, at least. Kindly 10 be recommended book for both FOP and TAS. Science of Pediatrics for the theory and science, and for foundation of practice, you can read the illustrated as well as survival guide, because few topics are very much well written in the survival guide. And for foundation of practice, you have to open the illustrated, because it's a very interesting book with the pictures and with the tables and graphs. These are very fantastic. Hussein has asked, dear doctor, for course related information. Okay. Doctors, I will be very happy if you will ask the question, open your mouth, open your mic, and then ask the question. If we were not confident in giving both exam together, can we give FOP and TAS separately? If yes, why should be given first? Okay, it's depend. Okay, if you are, if your basic knowledge like anatomy, physiology is very good, then you can appear in the TAS. But TAS a bit tricky one rather than FOP. But if you are very, if you have done the pediatric practice, then you can go ahead with the foundation of practice and you can easily pass the exam. If you join our course, then the course will guide you in each and every step because the syllabus has been changed a bit. Hi, Doctor. I am fifth year medical student, recently passed my final and waiting for graduation. Can I take the theory FOP and TAS part 1 while waiting for the internship? They just ask you for the degree. If you have the degree of MBBS, yes, they will. You just write your query on their website, and they verification they ask the degree, and meanwhile you prepare for the TAS and FOP. It's a very golden chance, Dr. Lei Yangxing. So it's a golden chance, and you are waiting. Then don't waste your time and just join our course and go ahead for the at least foundation of practice or theory and science. Will be theory and science will be better choice for you. Welcome, Kinza. I think I answered this question after FOP and TAS. How many months required for the this AKP exam preparation? As I told you that if you're confident one, then at least AKP people said that 6 months at least you have a sound knowledge of because in AKP is a data interpretation exam. They will give you a full page data and there will be picture, there will be ECG, there will be chest X-ray, there will be a picture of syndromic baby. So you have to, very much good in the data interpretation regarding AKP. So if you are planning to give the exam in AKP, then it's better that well prepared to appear in this AKP exam because AKP exam is I think more than 800 pounds. So it's better to get prepared and confident than appear in the AKP. Welcome. Dr. Azam, you asked this question that which centers available for exams in Pakistan for the theory exams. There are a few centers like in Islamabad and in Lahore. Both centers are available, but when you book the exam, they will give you the details about these centers. Yes, Dr. Bashar, I will repeat the books. For Foundation of Practice, you can prepare for Pediatric Survival Guide and you should read the guidelines and they change the guideline for every 2 years. Now it's turned to change. Now the guideline will change and illustrated textbook for pediatrics edition sixth edition. And for theory and science, Science of Pediatrics is excellent book for the theory and science. And of course, recalls. Is there any chance to revise recall exam for FOP and TAS? Yes, we have a recall session also. If you will join our course, then we have an option that we can discuss the recalls. And recalls are very tricky because somebody has wrote it and somebody, it's not a real thing. So it's just conveyed by one person to another. So it's very tricky one, and you should require a proper mentor to solve the recall. Afreen Humayun, I'm a medical officer of pediatrics since 5 years. Okay, I haven't touched books for a while. What should I attempt first? For if you're a medical officer in pediatrics, Afreen Humayun, I will recommend that you can choose the part two, applied knowledge of practice, or you can choose part one, foundation of practice. If you will join our course, then you can pass this exam in a first attempt also. When can someone get the GMC registration, Bashar? This is very excellent question. And if you will pass this exam, there's a three parts of theory exam and one part of clinical one. And if you will pass all the parts of this exam, so you can get your GMC registration. And before that, you have to pass your OET exam. Okay, Zoom user. After this exam, is there any chance to secure a job in NHS? Because nowadays we heard that there's a lot of saturation. Well, it's your luck, and but this MRCPCH is ST4 degree, ST4 level. So, if you will compare yourself with the pleb student, yes, they will give you preference over there. But again, job is a luck thing and all. Dr. Azam, thank you. Welcome. Yes, Dr. At at Zaz. So sorry if I misspell your name. FOP and TAS need to be passed separately or combined. No, no, not at all. For FOP and TAS, you have to be passed separately, and they conduct in a one day, as we discussed before. And but the AKP, applied knowledge of practice, there's a in AKP also they subdivided into part one and part two, and they will and you have a combined score required. Am I clear so far now? Dr. Zainab Imad asks, can someone write the names of books here, please? Yes, Zainab, you can just join our group, and our coordinator will write down the books names. And Hasnandia, Doctor. Okay. Okay, 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 okay. Regarding registration, as there a net problem. Okay, Bashar, I will tell you regarding registration. For registration, you have to open the RCPCH website. There is a registration form. You have to write down all your details, like your address. Address should be very correct. Okay, and your degree, your name of the college, medical school, and then they will take some time to verify it. And but remember this thing that before applying the exam, you should register on their website. Okay, they will give you the RCPCH number, and there will be a password. Every time you will log in, that you need to be this RCPCH number and the password until your even then your this number will become your membership number also. So Dr. Bashar, am I clear so far now regarding the registration? Okay. Okay. So Kinza Shafiq, you asked this question that it's been a month and I have a register, but they haven't sent any verification. Okay. Sometimes it happens. They get it, they take some time. So, but if you have any query regarding this verification and credential, you just mail them. Okay. And they will answer. Sooner or later, they will answer. They reply. Okay, okay. Actually, Bashar, yeah. GMC registration, Bashar, I was thinking that you were asking about the registration of the account and all. Regarding GMC registration, when you will pass all theory exam and when you will get the seat for the clinical, and you will also um, pass the exam, then for that, after that, you will enroll yourself and for OET, and you pass the exam, and then you register yourself to GMC and you will get the GMC registration. Thank you so much. Uh, is there any chance to contact coordinate the course regarding difficulty in session topics? Find a chance discuss. Yes, we have very efficient team of this coordinator. I think they will help you. You just write down your query and they will help you. Welcome, Bashar. Any questions? Welcome. Okay, so I think we discussed all the queries and all the scenarios regarding when to give, how to give, where to give. So thank you all, and it was very lovely session. And I'm very happy that you asked your questions. And if you have any problem, you can discuss these things to our team. We have a very efficient team, and they will reply you. And our course is very, regarding course fee should be paid before course. Just ask this information to our coordinator, and they will help you. Yes, thank you, Hasnan. Yes, thank you, Hasnan. So if you have any query, you can ask in our WhatsApp group. They will resolve your query. So thank you so much. Bye bye. Take care. Welcome. Bye. All of you. Bye.